Calley Means, it is great to meet you in person.
It's great to meet you.
I've read a lot about you. Particularly, to be honest, I was reading the New York Times hit piece on you, which they said you didn't want to comment for, and I don't blame you. Why would you want to talk to them? They write about you as though you're shrouded in mystery, that you've joined HHS and Robert F. Kennedy Jr. and the MAHA movement, but your background, it's always driven, this storyline is always driven that you come from a place that we shouldn't trust. So I'd always like to give people their own time to tell us who they are and where they come from.
Oh, well, thank you. I think this is a micro part of a larger dynamic happening where Bobby Kennedy and this MAHA conversation has unleashed, I think, a cultural, spiritual conversation about what's going on. I mean, President Trump calls Secretary Kennedy every week and says, I've got your back, go hard, go against these special interests. And millions of women voted Trump for the first time, young people, 50-50 young people for President Trump. Nobody could have imagined that 4 to 8 years ago. And then independents, 50-50. This was many variables, but this energy that President Trump unleashed around really fixing the root cause of our health and food systems, which are two of the largest industries in the country, very powerful industries, I think has both inspired a lot of voters, but inspired a lot of backlash. And my story is pretty simple. I grew up in the swamp, as I was just talking about. I worked for some of these industries, and in the past couple of years have had an awakening led by my sisters, who was a physician, a surgeon, Stanford educated, researched at the NIH. She left the medical system 5 years into surgical residency, said every patient I'm operating on isn't getting better. I'm getting screamed at by my attending surgeons for even talking about dietary interventions for these people that have fundamentally inflammation and metabolic disorders. And she helped me kind of put the pieces together in DC, really on a simple thesis, which is that there's many good people in the medical system, but the medical system is predicated on Americans being sick. 95% of the $5 trillion that we spend on healthcare are on managing sickness. And the longer people are sick, the more money the system makes. And it's led us to ignore the root cause of why we're sick, which is that 70% of a child's diet right now is ultra-processed food. And we're over-medicalized. Antidepressant rates and antipsychotic drugs for teenage girls have gone up 800% in the past 5 years. So we've got this really tough dynamic. My sister and I started speaking out, met Bobby Kennedy, Susie Wiles, and some other folks in the Trump campaign early on reached out. There was a lot of animation around this chronic disease issue, and President Trump was talking about this issue well before the Bobby Kennedy endorsement. So I, as Bobby Kennedy said, helped connect the two men shortly after the Butler shooting. I was a small part of it, but I called Secretary Kennedy an hour after the Butler shooting, and we talked about him calling President Trump, and he was feeling, I think, a lot of emotions. I mean, he's had a lot of history, Secretary Kennedy, with assassination attempts, and I think one thing Secretary Kennedy and I bonded over, and I think really connected with a lot of the country, is he's on this mission about children's health. I mean, that's what it's about, and then President Trump was talking about that issue too. So in that moment after Butler, I was able to help with that connection and have a small vantage point into their conversations. And I think this connection that was 1 year ago yesterday has been so powerful and so transformative that I think there's a lot of energy towards me, towards my sister who's up for Surgeon General, and many people in this MAHA movement. There's a lot of animation to tear this movement apart. But the good news is that at its core, something very, very positive, and I call it spiritual, is happening, where when we're in meetings at the highest level, with President Trump, with the administration, we're literally talking about how do we help kids get healthier. That's all we're talking about. And I think in the past 6 months, we've had the best record in modern American history on reforms to our food and healthcare systems. And I think there's a lot of people that don't want that.
Yeah, no, that's absolutely right. And I think Mr. Kennedy has consistently said, even up to and including last week, if I saw it, he consistently says that President Trump is helping him deliver on something that he never thought achievable. He just didn't think it was going to come out of this town.
Well, you can go down the list, and I don't think people fully even realize this, but when you look at food reform, what we did is we're not going to be nanny state here, but we're going to look at incentives. And the first thing we did is looked at SNAP, the fourth largest entitlement program. We spent $120 billion on food assistance for lower income people. 70% of it was going to junk food. 70% of that money is going to soda and ultra-processed food. So Bobby Kennedy and President Trump worked with governors around the country, and to this, right, as we say here today, 22 states have worked with the federal government to remove soda and candy from SNAP. So that means more healthy food going to kids. We have worked with the FDA. You won't believe this, but up until the Trump administration, right now, the FDA did not have a list of the chemicals in our food. So before we get into any regulation, it was self-policing from the food industry due to a regulatory loophole. We should at least know what's in our food and be able to study it. So we've reformed that process. We're going to have transformational dietary guidelines. The dietary guidelines under President Biden recommend added sugar as a healthy part of a 2-year-old's diet. They recommend against meat to this day. They recommend against meat.
And those things are what, lobbying efforts?
The dietary guidelines have been an orgy of corruption and seen as a ultra-processed food lobbying document because the dietary guidelines go into what is served at schools, the military, prisons, government buildings. So it goes into a lot of procurement, and it also has a big cultural impact. I mean, we remember in the 90s the food pyramid, which said basically eat as many carbs as you want, don't eat meat. That still has a lot of legacy to today, and parents, people follow government guidelines.
Not to besmirch Mrs. Obama, but that whole let's move thing and let's get healthy thing and going after school lunch thing, that was really sort of hollow given what you guys have achieved in a short period of time at HHS.
Yeah, people bring up Michelle Obama a lot. I mean, I actually credit her in the first year for talking about children's food, but she had the wrong solutions. She developed a 500-page top-down USDA document, lecturing schools about meatless Mondays and the type of dietary philosophy. If you notice, MAHA, we're not actually lecturing about whether you should eat kale or this or that. It's really just about whole food. It's about back to basics. So what we're actually doing is making the USDA guidelines much, much simpler and working with schools to empower them to serve, maybe it's more kale in California, more beef in Montana, but it should be whole food. It should be celebrating local farmers. And there's a lot of positive relationships that are being built with states to do that. She also talked about soda taxes, kind of coercive things. We're fixing incentives. SNAP, we should not be paying. Soda's great. People should be able to buy their Coke. We shouldn't be funding that with government programs for lower-income kids.
I was driving down the highway not too long ago, and I saw a Steak and Shake billboard, and it said, "Now beef tallow." Anything else would be sus. It was very funny marketing. Totally embraced it. Good play. What is that? Why should people care about things like that?
Okay, there's been many good policy reforms in the past 6 months, and there will be many more. We're going to have better food labeling too, which is just basic transparency. But I think the greatest accomplishment of this administration, what will go down in history, is there's been a cultural awakening. Every single food company, every single farming company, every single healthcare company is thinking and talking in their boardrooms about the fact that there's a demand from Americans to be healthier. And I actually read a Wall Street Journal article the other day where snacking, just basic junk food snacking, has gone down 8% this year. So parents are reading food labels. Moms are talking to their local schools about better food at the schools. People are becoming more aware of what they're feeding their children. This is a really, really good thing, and it's core and what separates us from Michelle Obama. We're driving public health messaging, societal awakening, which is changing the market.
You know what I'm hearing? I also heard from a couple of people that are senior-level alcohol executives. They've said they're seeing a precipitous drop in consumption of alcohol.
It's at an all-time low. Alcohol consumption. So what the administration's doing is legitimizing conversations that are happening around every kitchen table about metabolic health, about, maybe the skyrocketing obesity, diabetes, heart disease rates. It's not just a drug and a pill or a jab that's going to solve those. Maybe we need to think about, our food and what we're putting in our bodies and our over-medicalization. That societal awakening that I really credit President Trump and Bobby Kennedy for will be the greatest legacy. That's what's going to drive health. And we've been meeting with all the CEOs of all the major food companies. They're responding to market demand. Coca-Cola, the majority of their revenue soon will be no-calorie drinks. and their stock's at an all-time high. I think that's great. People are responding to market demand.
Can I ask you why it is? Is it purely bottom line? Is it profit driven? I choose not to believe that everyone in corporate America is trying to outright poison consumers, but they were putting weird things in it, like petroleum-based food dyes. Why? And did it need to be called out before they'd stop?
Yeah, I don't think it's any one person's fault, and I think that's what's tough about this, is why I think it's so important. We've been engaging with every single stakeholder and figuring out how to get beyond this, because everyone agrees the situation's not good right now. But when you look at the stats, and the MAHA report we released goes into these, there's something wrong. So 70% of a child's diet in America is ultra-processed food. It's 15% in European countries. So in European countries, kids are eating predominantly whole food, and here it's junk food. And then you look at that, is that because companies are evil, Americans are trying to poison their kids? No, there's been really bad incentives. So that's what we're doing. We're going through the medical recommendations, the incentives. But when you have a SNAP program that's basically saying it's okay, SNAP pays for Twinkies, SNAP pays for Oreos, SNAP pays for soda. And then food companies actually lobby to make sure that's all essentially people can buy. We have, again, guidelines saying ultra-processed food is not harmful for children. That's what President Biden said. The USDA put out a thing saying a diet 91% ultra-processed food could be healthy for kids. Totally co-opted. So when you have incentives and then the medical guidelines and scientific guidelines actually recommending this stuff, what are Americans supposed to do? So that's what we're drilling in, the incentives and the guidelines. And I think why one of the greatest accomplishments of this administration, we're getting control of the NIH. The NIH has been a dumpster fire. The NIH funded the creation of the COVID pandemic, funded gain-of-function research, and then it just came out they made $400 million in royalties from Moderna for coming up with the quote-unquote cure. The NIH has not been studying the root cause of why we have the highest cancer rates in the world, why we have the highest rates of diabetes in the world, the highest rates of Alzheimer's. These are all metabolically based conditions tied to our food system. So we're going to get back to good scientific research and then look at health incentives. I mean, we spend $5 trillion on healthcare. We're accepting everything as a given that we're the sickest country in the developed world and then just drugging everyone. And unwinding those incentives is what we're trying to do.
And then ultimately, is this, everybody is consumed with the idea, does it stick? You won't be here forever, you can't be. That's our system. So is this a lasting legacy that future administrations can't undo?
That is all I'm focused on. That is all Secretary Kennedy's focused on. That's all we talk about. Will this stick? My opinion is that President Trump and Bobby Kennedy unleashed something in this country that cannot go back in the bottle. I do not think moms will want the petroleum-based artificial food dyes, which are banned in every other country. I don't think they're going to want those back in their children's food. I don't think moms are going to want to go back to having less healthy food for kids. I don't think we're going to want to go back to a absolutely co-opted FDA, and we're fixing that. I think there is a societal awakening happening, and I'll be blunt, what I am very focused on is that this political movement stays together, is that this coalition of women, independents, young people, these swing voters impact future elections. People should be giving credit to this administration for being very brave. That should be reflected in the midterms. And as this political coalition stays together and more people vote on children's health, that will be a great legacy of the Trump administration. I think there's a lot of people that want this to go away, that want this conversation to go away. I don't think it's going to. I think that's because people have woken up and we are delivering real wins.
The lobbying in this town is probably more aggressive against Bobby Kennedy and your department than any other, fair to say? And President Trump has sworn up and down, I got your back and I don't care who throws what kind of money at us, we're not backing off.
It's inspiring. He says that all the time. And we, just from a pure political dynamic, that corporate interest, the lobbying, the money, that mattered when people didn't vote on this issue. President Trump found a coalition that's demanding better policies around common sense issues like this. And President Trump stands up for his voters. And he is absolutely providing air cover for Secretary Kennedy. We have a generational team. I mean, Marty McCary, Jay Bhattacharya at the NIH, and Marty at the FDA, and my sister up for Surgeon General. She's incredible. Dr. Oz. I mean, there's a dream team here that is just empowered by President Trump. Lowering pharma drug pricing. I mean, that's a big one. We spend 10 times more than any other country in the world for all these drugs. So we're taking this on many, many fronts.
Do you get the sense, and I'll let you go, you've been generous with your time, do you get the sense that the medical community, your sister comes from it, pharmaceuticals and food companies are sort of a given? The medical community still, when people get informed, they get smarter, they start to challenge and ask questions. You still got a lot of persnickety doctors on the front lines out there that say, who do you think you are coming in and challenging my conventional wisdom, right?
Well, yeah, I mean, the American Academy of Pediatrics just, when Secretary Kennedy took the COVID vaccine off the CDC recommended schedule for 6-month-olds, no-brainer decision. 95% of parents are ignoring that advice right now. I mean, it's just common sense. The American Academy of Pediatrics says, no, we're having our own recommendations now, and every single 6-month-old in the United States should get jabbed with the mRNA COVID shot. Every single one. So if they don't have the humility to realize that Bobby Kennedy and President Trump are fundamentally right, that we're correct to lose trust in the medical system after COVID, after the fact that we're the sickest country in the world, spending more on healthcare than any other country, and everyone's telling us it's fine. So you have lobbying efforts that are still, I think, very out of touch. But I'll tell you, one-on-one conversations with these large groups, they all, off the record, admit that this is unsustainable. They admit that we can't go. Even pharma, honestly, they're playing ball. There's going to be nasty back and forth and underhand attacks and hit pieces, but Bobby Kennedy and President Trump are right. Something really is wrong with the incentives of our healthcare system, and I think it's civilizational. I mean, health spending is the biggest part of our budget. We're not able to recruit enough people for the military. 77% of military-aged youth aren't eligible to join the military right now. It's going to cause mass economic problems because we have such a, we're a very overweight, sick, depressed population when you look at the numbers. This isn't any American's fault. These are systemic issues. So I think we've won the argument and are winning the argument.
I agree. Your department, Bobby Kennedy, your work has, specifically with women, I've seen it. I've seen it in my own life. Women and their children matters a lot, and boy, they are locked and loaded with you guys. Thank you for the work you're doing on behalf of a very, very grateful nation. Sincerely. Thank you. Calley means pleasure.